Welcome everyone to another edition of the Miseducation of the American ... Today we're filling in those dots with Black trauma and Black mental health with our guest, the guru of mental health, Dr. Carla Stewart. Welcome, Dr. Stewart.
Thank you. Thank you so much for having me.
I am so excited to talk to you today. You are everywhere. So whenever I open up Facebook, whenever I open up Instagram, Twitter, I see that you are participating in another speaking opportunity or workshop. My goodness, I am impressed. I don't know how you find the time of day, but she does, y'all. She is at the top of her game where this is concerned. So can you tell me a little bit and tell us a little bit about your work as it relates to mental health, and then even just giving us like a definition what does it mean when we say mental health?
So I absolutely love educating about mental health and wellness. That's what I have been passionate about for a long time. I started my practice 11 years ago, came into the field 17 years ago. And so a lot of my foundation in the field is based on doing education surrounding social, emotional health, mental health, and wellness. I started as a mental health consultant 17 years ago in early Head Start and Head Start. And then as I went through and got my degrees, my focus became educating counselors on how to address the mental health and needs of a greater community. So when we think about mental health, what we typically think about is mental illness, right? Or what's often known as mental health disorder. So sometimes we confuse those words and we use those words interchangeably. And so when I'm asked the question, how do we express mental health, or how do we figure out what the definition of mental health is? I always say, well, what is physical health, right? Because people are able to tell me what that is almost immediately.
Right.
You know where to go, you know what to do when something feels off physically. So it's always made me wonder why the concept of mental health is so mysterious, so elusive, and so stigmatizing to people. Why is it treated different from physical health or dental health or podiatric health? It makes you wonder, like, why is that different? Because mental health is a part of you, right?
Is it because, do you think there's a part of it because it's that invisible thing? So my physical health is something like if something's wrong, like visually, I can see it, whereas mental health is something that I can kind of hide behind.
That's true. I think that's one of the reasons. But you think about it, we don't really see our organs either. But we know something's wrong on the inside, so we have to take care by going to see somebody to take care of the things that are going on inside of us. So mental health includes emotional health, psychological, and social well-being, right? Those are all things that encompass mental health. And it affects how we think, it affects how we act, and it also helps to determine how we handle stress, how we relate to others, and how we make choices in our lives, how we handle, recover from, and adjust to life's challenges. So it really encompasses all of those things.
That's a lot.
That's a whole lot.
That's a whole lot. So so thinking about just all those range. So when I think of mental health, so you are a therapist, right?
I am.
And so one person can't deal with all of the things that you just said.
Right.
So there's all of these auspices too that I think also become really confusing for people.
Yeah.
Okay, who do I go?
Who do I go to? A psychologist, a psychiatrist, a social worker, a therapist.
Yes.
Right. And so there are different levels, and each person in the discipline does a different thing. Right. Everybody does therapy. Pretty much everybody can title themselves as a therapist. So social workers do therapy, counselors do therapy, psychologists do therapy, and psychiatrists do therapy as well. But when you get to the psychologist and the psychiatrist, now you're looking at it more of assessment and medication management. So psychiatrists are mostly known for prescribing, right? Counselors don't prescribe, social workers don't prescribe. Psychologists can prescribe, I believe, and I know for sure that psychiatrists can prescribe. So there's so many different ranges and so many different people that you can go to. So sometimes it can be confusing.
Yeah.
But what you want to look at is, what issue are you dealing with? What issue is coming up for you? and there's likely a therapist that specializes in that particular issue. And so that's where you begin to look.
Yeah. So, okay, let me joke. So I know that after my mother passed away, I had a terrible time trying to find a therapist that looked like me.
Yeah.
I wanted to have a Black woman specifically that could address my issues. And I know I have a family member right now who is a Black male who is looking for a Black male counselor that he can relate to. I love it that he has acknowledged that he needs that help, but is struggling to find someone who looks like him. And then I came across a statistic that said only 5% of therapists are Black. What do you attribute that to? So you just talked about all those different fields. Why do you think there's such a shortage of Black therapists?
So to speak to what you first said about finding someone that looks like you when you're looking for a therapist, most people feel a connection to someone that they believe has a shared cultural experience or a similar lifestyle as them, right? You want to connect with somebody who you feel can help you from a shared perspective. So in the last 10 years, when we think about what's been going on, there's been a focus on STEM careers, right? And careers that have been viewed as more lucrative. So let's just face it, working in the helping professions is not necessarily a path to great wealth. Okay. So I teach at a local university, and I'm seeing an increase in Black and Brown students in both our clinical and our school counseling programs. So given what's going on in society, minority therapists are increasing, right? So we're seeing them come back. It's coming back because back in, I'll say maybe the late 70s, early 80s, counseling was a boom. That was something that people were doing, they were engaging in. And then we started to see that shift when there became a stigma connected to mental health. So with that stigma, you started seeing more people going to different directions, especially with not having as much financial backing as other professions did, right? So
Is it because also we've stripped away, like I just know thinking about like mental health services just seem to have been eradicated.
Yeah. They started taking funding for mental health services. So people were like, well, they weren't trying to pay out of pocket because that could get expensive. A lot of people wanted to use their insurance coverage, and the insurance coverage for mental health wasn't as much as, say, for example, if they saw a medical doctor for a mental health issue. So same issue, but the medical doctor got paid way more than the therapist did. So that's what we've been experiencing the last couple of years. But I think that based on what's going on in society right now, we're seeing an increase. We're seeing people, fighting for increase in funding for mental health. So I'm hoping that we're on the upswing in that area. But to speak to your point about your family member, I definitely can understand about wanting to have that, a therapist that shares your experience or that understands your experience. That's definitely important, and I don't want to minimize that. But I want us to look at it from a slightly different perspective. So I personally have never experienced the loss of a parent, but I've been on the backside of grief, right? So my not losing a parent didn't prevent me from assisting a client who had, in fact, experienced that loss. It was the empathy that what was connecting us, not the specific situation. So although there are Black male therapists, I know a few, I've taught even a few more, I don't want someone to prolong getting assistance because they can't find someone that fits all of their check boxes.
Okay, that's good.
Yes, there are several resources in the Chicagoland area specifically where your family member may find what they're looking for. There's a Black mental health directory in Chicago. It's called the Black Mental Health Directory Chicago. There's Psychology Today where they can search out specific things that they're looking for. There's even a site called Therapy for Black Men that they can go to. So there are resources out there, but I don't want anyone to not get in treatment because they're not able to find someone that just kind of like Match.com that doesn't match with them exactly the way they need to.
Yeah, and I like that you said that because I think that we are looking for some kind of magical connection, some idyllic type thing, and that's not always out there. We just have to get our feet wet and put our feet to the fire. Do you think that Black people experience mental health differently than other races or ethnicities?
That is a great question. And so What I'm going to say is symptoms and mental impairment can vary from person to person, not just across race and ethnicity, right? So there are a lot of factors that contribute to the variation in how mental health concerns present themselves. So to give you a few examples, environment could be one, family history could be another, brain chemistry, and then there's also things that are called risk factors. So what I've seen as the major difference across the races and ethnicities is how mental health disorders are viewed and subsequently treated. Not necessarily how they experience it, but just how they're viewed and how they're treated.
Okay. Okay. Now you're getting into some stuff. So how they're viewed and how they're treated. So
Yeah.
I was just facilitating a training about how Black patients are given less medication for their pain than other races, specifically white folk. Do you think that same, not necessarily with medication, but that same disparity in treatment exists among Blacks versus other races?
I would say yes. And I would say it stems from a lot of different things. And one would be, how do we as a community, as a race, view mental health, right? How is it that we view mental health? What I've heard historically is that what goes on in this house stays in this house, which in some cases, that's appropriate. You know, we're not talking about secrets, but we're talking about usually when there are issues going on in the house, and we noticed that John got a little, you know, he's got some issues going on. He has some anger issues, or he's snapping off, or he's wilding out, going through these different bouts of mania, or, you know, he's really, really high and elevated in his mood and really, really low. We tend to try to handle those things in-house. We try to handle them in-house, or we try to handle them within our faith communities. You know, we talk to the pastor, we talk to Big Mama and them, but we really don't get the assistance we need. Why? Because this thing that we call a label. That's what stops us a lot of times, because people think that there are labels that go with certain mental disorders.
But aren't there? Or aren't there, like, in thinking about being a Black person in society today, that's already in and of itself its own label. And then additionally, to have an additional label, isn't that stigmatizing? Isn't that something that we want to necessarily avoid if we could?
I definitely agree to an extent. And so what I push back on when it comes to that is the line of thought. And when I push back with people, there's really no real answer that they give me about this label. And it's this, I don't know where this label is or how it got here, but it's like this label, right? So I asked them, who's labeling you? Where's this label going? How did you get this label? Okay. So first of all, people have passed this down from generation to generation. And second of all, they're often referring to the academic system in special education. You know, I don't want my child to be labeled. So we could probably park there for a while if we had time. That's a whole different topic in itself, right? Because people are always talking about, I don't want my child to be labeled. I don't want my child to be labeled. But I'm going to take us back to our initial comparison of physical and mental health. And this is something that I wish we as a community could definitely unlearn, okay? So I use this example when clients first come to my office, and most clients utilize their insurance benefits to see me, okay? So the insurance requires a diagnosis in order to pay for services rendered, right? So I see a lot of clients and they fear this diagnosis, or AKA this label. So I explain that this diagnosis consists of a set of symptoms that goes with a set of numbers that allows the insurance company to pay me for my time in assisting you. What it also does is allows me to know what I should be working on with you in our sessions. So you wouldn't go into a doctor's office and say, something's wrong with me. And that's the only thing you say, right? Never giving him any symptoms to work with or expect them to come up with a treatment plan or any of that. You just go in and say, something's wrong with me. How is that doctor going to help you? So your doctor also uses symptoms to formulate a diagnosis so you can receive the treatment you need and the insurance company can pay for your services.
Okay, so, I get that. I get that. So let me ask you this though. So when you though, when it's, say you go and you find out I have cancer, right? That's,
Mm-hmm.
I have cancer. There's a certain level of sympathy and empathy that the community provides for me
Definitely.
versus, and I'm going to say his name once and I'm not going to say it anymore because you told me not to talk about him, but versus like a Kanye who
Right.
we see has this label and yet people still seem to almost vilify it versus having this empathy and understanding for it.
And there's a lack of understanding surrounding mental health disorders. Remember, people are looking at mental illness versus mental health, and those are two different things. They're on the continuum, but when you're talking about mental health, it's all of those things that I mentioned earlier. How to deal with stress, how to, are you resilient, how to deal with your thoughts, your emotions, your feelings. That's what mental health is comprised of. And what we're speaking of also is the aspect of mental illness, right? We know of Kanye's diagnosis because someone told us.
Very
If
true.
if no one told us, we wouldn't know anything about it, right? The same thing with these labels that we talk about, because generally, unless it's for the purposes of receiving some type of state assistance, which a lot of times people who are diagnosed as severely mental ill, they get some type of assistance from the state. No one outside of you, your therapist, and your insurance company knows what your diagnosis is. And we can't disclose anything to anyone without the client's written permission or consent. So where is this label actually going? Unless you share it, right? Yeah. So when people talk about these labels, they don't want to be labeled. Nobody's really labeling you. They're just saying, this is your broken foot. And so in order to treat your broken foot, we need to know that your foot is broken in order to do blah, 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 blah. This is depression. In order to treat your depression, we need to know your symptoms so we can do this, this, and this. It's no difference.
Yeah.
So we get stuck on that whole label idea.
We're the only ones that can disclose that.
You're the only ones that can disclose it.
If we're labeled, it's because we've put a label on ourselves.
Exactly.
And I could imagine.
And I know that sounds super simple, right? That sounds real simple, but that's actually how I view it. I look at it like that. It's like if your therapist doesn't say it, if your therapist doesn't disclose it, if you don't tell anybody, who will know that you're diagnosed with bipolar disorder? Who will know that you are diagnosed with post-traumatic stress disorder? So where does this label come from? It's not like you walk out the doctor's office and there's like, kind of like back in the Bible days where the lepers, unclean, unclean, right? Nobody walks out of the doctor's office and it's just a little sign over your head saying this one has bipolar disorder. That doesn't happen. So nobody knows unless you share it, or unless there's some reason for it to be shared, like some type of state assistance or, those type of situations. But there is really no label. It's just a diagnosis to help treat you.
Can I come back to something you said earlier? You talked about like in the Black community, we have a tendency to want to handle things in-house. Mm-hmm. And we are sometimes reliant on non-professionals to fix an issue that professionals really should address. What are your thoughts about that? And is that detrimental overall to our community?
So my thoughts about that are, I know it's been what we had to do in some cases. Sometimes you do what you have to do when you are not able to do anything else. And so for what it's worth, I think that the intent was in the right, their heart was in the right place and they wanted to help and they wanted to get the person help, but they just didn't know how, or they just didn't know where. And also it's something you spoke to earlier, how we're treated in this medical system with this medical model also keeps people from, engaging in treatment as well, because they feel like, okay, if I go to a psychiatrist, all they're going to do is write me a prescription. And I don't really want just a prescription. And think about the over medication of children. It's so many different layers to that as well. And so I think initially people were using it as a means of protecting their family. They were trying to protect them. They didn't want them to be harmed by the medical system or the mental health system. They didn't want to be labeled. Here we go with that word again. They didn't want to be labeled incorrectly or, have to put their loved one in an institution because, they were diagnosed with something that they may not understand, and they just took the word of the doctor. So I think, again, it was for protection initially. But as we grow and as we evolve and as we learn different things, I think that we should be open to getting assistance outside of ourselves, because there's no way that we can know everything. you know, as moms, as dads, as aunts, as uncles. It's only, there's an extent, there's a limit on our knowledge. And so if I can find help outside of my home that's going to get us what, you know, peace in our home, or get my child the assistance they need to be successful and healthy, then that's what I'm going to do.
I love how you frame that, because I love that you didn't denounce that, yeah, we did what we needed to do for the time that we needed to do, and that can be a bridge for something better.
For something better. It can. Because
So,
that's what we did. Like, think about how our ancestors and how everybody, we grew up, and there were some things that they did then that we don't do now, right?
yes.
But they did what they had to do at that time. So I don't demonize them. I don't look down on it. I just said they were in survival mode.
Yeah.
And in that moment, they were like, there's nobody to help us. Nobody can do this for us. So we're going to do it ourselves. We're going to talk to the pastor. We're going to talk to our grandmama. We're going to talk to this person. And that's just how we're going to do it. And that was okay for that time.
Yeah. That's good. That's really good. And it brings back some memories, even for me, being able to talk to my grandmother about some things. And she might not have had a degree in counseling, but she was good. So thinking about me as a Black mother, as having Black children, and especially a son, and I know you can relate to this. I feel traumatized every time I look on television and see these instances of Black death and Black pain, and especially because my son is a suburbanite who I don't think he fully understands the skin that he lives in and what that means. So for me, it's frightening on a number of levels. And I wonder, what do you think is the present and future impact or effect of seeing these instances on people of color, specifically Black people?
So I think this is real heavy because it's consistent. It's in our faces, on repeat news cycles and news feeds. And unfortunately, it does not seem to be letting up. And I think that's probably the hardest part for me as a mom, as a Black woman, even as a wife. That's hard for me. And so we're dealing with a sense of vicarious trauma and collective hopelessness, right? Because this is what we're seeing all the time, and we're experiencing it as if it's us. So when we see someone be killed on screen, when we see it up and down our newsfeed, when it's constantly blasted on the news, it's almost like automatically we see our loved one in that position. And that increases fear, right? Because we're like, that was someone that was just going on about their day and that happened to them. Could that possibly happen to me?
Yeah, Dr. Stewart, I transpose my husband, my daughter, my son, in all of those circumstances.
Myself.
Yes.
Right?
Exactly. Yeah.
Myself. Because nobody, when I'm driving down the street, nobody knows, other than the fact that my license plate says I'm Carla, that I'm Dr. Carla Stewart. They don't care about that. That doesn't matter in that moment. And we've seen professional people, we've seen, you know, the good citizens be the ones that are targeted. And so it's hard. So we watch it, we see it. So there's that vicarious trauma, that collective hopelessness. But what we're also seeing is an uprising and a fatigue that's leading to action and movement across all areas. So not just in mental health, but people are demanding change in government, in media, in public service arenas, and mental health and wellness is appearing like it has a greater prominence in the conversation, right? So I believe that what these movements are highlighting is the need for a more holistic approach to the care of us. It can't be just about making sure my blood pressure numbers are within normal range. It also has to be addressing trauma, providing coping strategies, healing generational pain and suffering, and normalizing discussing the things that hurt, harm, and trigger us. So I think that's the direction that we're going in, because more conversations are centered around mental health, mental illness. So I think that it's a good thing, even though it's what's the impetus is throwing us off, because we're like, why did it have to be so violent? But what it's doing is it's opening up more dialogue for all of us to say, okay, we need to do something about this. That we can't be silent anymore. We can't stigmatize mental health anymore.
I do believe it's revolutionary. I believe this moment in time that COVID and all of the things that it's taken from us has actually given us the ability to uncover some things too. Let me ask you this: do you, speaking of COVID, and it's especially harsh realities for Black and Brown people, what do you think that there is going to be, and what can we do? I know there's this collective action, but what can we do as individuals to avoid like the PTSD and to ensure that our trauma doesn't compound? So we've seen bodies, now we've seen COVID, we've seen violence on Black bodies, and now we see COVID. So what do we do to ensure that this doesn't like keep
re-traumatizing us?
Yes.
And I've been saying probably since COVID began that it's going to be a while before we really recognize what the effects of this have done to us, because right now studies are starting. I am almost positive studies are starting to figure out how this pandemic, how being isolated socially, how, being on Zoom all the time and being on, doing everything remotely, what impact this has had on us. And so I know it's going to be probably several years before they'll, be able to collect the data on this.
And we're communal people too. So I can imagine how hard I know how hard it is for me having to not be able to commune with friends and family. So.
And it's difficult. And it's difficult even for those that would consider themselves introverts, right? Because now everybody who's extroverted is at home with you, invading your space. So all the introverts are like, this is way too much, right? So in order to keep us on track, one of the things that I have been saying since the beginning is take a break from all things media. Please take a break from all things media. It's okay not to know. It really is. It's okay not to know. So having someone to confide in, even though you are, maybe still isolated a little bit because of the, requirements with the phases that we're going through, getting quality sleep, having interest outside of being concerned about COVID, because that's enough to make you anxious. Watching the news reports and watching the numbers and the death tolls makes people anxious. It raises their anxiety, because anxiety is concern for the future. It's a fear and concern for the future, right? So you have to find activities that are self-nourishing, whatever that means to you. For everybody, it's not travel, because I've been hearing people saying, oh, I just want to travel again. I just want to travel again. For some people, it may have nothing to do with traveling. It may not be manicures and pedicures. It may be reading a good book. It may be getting on a Peloton. That's the bike, right? Because I've been hearing about this Peloton thing.
Developing the one that had the bad commercial. That's all I remember.
Developing coping skills, or finding ways to increase your coping skills in a healthy manner. So those are all the things that we have to do. But number one, and I'm going to go back to that one, get off of social media. Step back. Take a step back. It's okay to not know what's going on. It's all right. So doing those things that are going to feed you and feed and nourish you and not feed your fear is what's going to have to be the focus. So because post-traumatic stress disorder, PTSD, is what comes as a result of some type of vicarious trauma. So watching those videos of people dying, it comes through that, right? And so we have nightmares and flashbacks. Well, if I'm not seeing it, I can't have a flashback of something I've never seen.
Yeah.
Right? So we have to take a break from all of those things.
I've been hearing this terminology like trauma porn, because it's not even just in social media, Dr. Stewart. Like I see it in like the movies and all of that. Like I was talking to someone today just about the movie Queen and Slim and how that's just inducing, like it's just like this. And I think there are great things, like we see 13th and we see Just Mercy, but I still think that there's an element of trauma there too that hit.
And that Just Mercy was a bit much for me. We went and saw it at the theater, and I recognized that was a movie that was a great movie, but that I can only see one time in my life. Yeah. I couldn't watch it more than one. And I sat in that theater and cried, and I said, I can't watch this more than once. Because although it was set decades ago, it's exactly what's happening right now.
Exactly.
And so now, like you spoke about transposing and putting your family members in there, I was looking at my sons on the screen, and I'm just like, Yeah. So you have to have a healthy diet of things that are going to feed your spirit. And I'm not talking about spirit from a religious place, but I'm talking about feed the thing that drives you. And you can't be driven by the fear. And you can't be driven by that trauma porn that you talk about. You can't be driven by those things. And so it's important to really take inventory of what you're ingesting, what you're talking about, the conversations you're engaging in, because everywhere you go, people want to talk about this stuff.
Yes.
Right? And I have to turn, people think I'm antisocial. We don't get to go too many places, but I don't want to talk about this all day. And then everybody wants my opinion as a therapist. And I'm like, I'm off the clock.
Yeah.
I'm not,
yeah. You're protecting yourself. You have to protect yourself.
I'm protecting myself. And that's what we have to do. We have to protect ourselves.
So I have so many really great friends and allies who are white who say, like, how can I help you? When it comes to mental health, is there a place for that allyship? Is there a place where I can say to my white friends, this is a place where you can enter in and offer yourself as an accomplice and an ally?
And so that's a hard one, because when you're dealing with mental health, a lot of those things are internal. A lot of those things are personal to you, right? And so what I see as allies, whether white friends or family members, is support, supporting you, being a place that you can be vulnerable and without judgment, because there's a lot of judgment when it comes to issues, and things you're sad about. The first thing people want to do when you're sad and upset is give you a list of things you should be happy about, right? People do that all the time, and that's so dismissive. And it's like, well, no, I know that there are some great things in my life, but right now, this is what's going on, and this is what is happening, and this is how I feel about it. So don't try to get me to happy if I'm not feeling happy yet. Let me experience the full range of my emotions. But that comes from people not feeling comfortable with emotions that are other than, happy emotions. They don't feel comfortable with that. They don't know what to do with it. And so a lot of times they don't have the empathy. So you need friends and allies that are empathic, that have not necessarily experienced what you've experienced, but can touch that side in you, that part of you that they've experienced. Kind of like what I said earlier about the mom, me not losing a parent, but I'm able to connect with the grief and the loss that someone else has experienced. So you need people in your life that are going to be that for you, not a person that's going to say, well, at least you have your other parent, or at least, or silver lining it. That's not what's needed. So in a good ally, no matter what ethnicity they are, you have to make sure that there's somebody that is supportive, that can take you at your best and take you at your worst, that are going to let you be vulnerable with them without judgment, and that are going to let you process whatever it is that you're dealing with.
Wow, just sounds like a great friend, right?
Yeah, that sounds like a great friend.
That's all that I want in a great friend. So before I get to my rapid fire questions, my last question for you is, what are things that you think that we need to unlearn when it comes to Black trauma and Black mental health, or things that we think that we know, but we really have all wrong?
So one of the things is what I mentioned earlier, is that whole idea of labeling. Labeling, and I think I spoke to the understanding, helping you guys to understand what labels really are and what that really means. So being afraid of a label or being afraid of a diagnosis. Diagnosis gets you targeted, specific help that you need, right? If I go to the doctor and I say I have heartburn, he should not be looking at my knee, because that has nothing to do with that, right? So if he starts working on my knee, the issue with my heart is not going to be fixed. So that's what diagnoses are for, to get you the help in the area that you need help. Also, another issue that I want to see eradicated is the fact that we don't need counseling. I don't want to talk to anybody about my problems. I do not want to, tell my business to a stranger, right? Those are the things that we need to really address. We need to let go of that, because this is someone that's unbiased. This is somebody that is trained to get you the help that you need, to help you look at things from a different perspective. This is a person that can have insight into things that you may not have even thought about and is not close to the situation, because we have some natural helpers in our lives, right? Good friends, good family members that will love to give you some great advice, right? But their advice is typically based off what they already know about you. So they may be a little bit biased, but you're talking to someone that is not biased, that is objective, that is not only going to take your side, but it's going to help you see things from all perspectives. And so I wish that we would engage in therapy more. There are so many therapists out here, and it's growing. The number is growing steadily, and that's a good thing. So there's somebody that will meet your need. So if you've been to therapy once and it didn't work for you, try it again. There's another therapist out there. I tell my students all the time, there are enough people in the world that everybody can have a therapist. Everybody. And if somebody doesn't want to come to you, then that wasn't your client, and that's okay. They have a therapist out there that will meet their specific need. So make sure that you all are out there. I know this sounds like a ringing endorsement, a commercial for therapy, right?
Yes. I've seen cut. No, I'm just kidding. But I guess I don't understand Dr. Stewart, because I guess I grew up in a household where therapy was like lauded as this thing that you should do. So it like, I see it as a release versus somebody like in my business. I look at it as like, ooh, I get to talk for an hour and get this off my chest.
Yes,
like
no interruption.
Yes, and have an opportunity to get like good feedback and like a direction sometimes. Like sometimes I leave out with a direction and it's like cleansing for me. So I wish everyone had that experience and that outlook, because I tell you, like, therapy is has made me a better person, has made me a better wife when I've gone to marriage counseling and had that type of therapy, has made me a better parent, has made me a better daughter, even going through grief counseling to get over that. So like, I'm all about it. Like, I wish I could be a poster child. So I'm a ringing endorsement for your commercial.
Yes, thank you.
It isn't necessarily about from my experience, about telling somebody my business. It's about unburdening myself of undue stress.
Yeah,
and making myself better.
Helping me learn how to deal with stuff that I maybe never was taught to deal with.
Yeah.
So many things, like when I think about parents, and you don't come to this world, the child doesn't come to the world with a handbook, right? So it's so many things that your children experience, or you experience as a person, that no one teaches you how to deal with. No one knows, because they haven't experienced it themselves, right? So you have someone that you can go to that can help you with that.
Yes.
They can help you learn how to process your emotions. They can help you learn how to deal with intergenerational trauma and things that you've had to endure and experience. They can help you deal with stuff like bullying or being rejected, because we don't know how to deal with that. We dismiss stuff all the time. Yes. Yeah. You know, we dismiss things all the time because, again, that goes back to not wanting to deal with uncomfortable emotions, not wanting to see somebody cry. How many times has somebody told you, don't cry? What do you mean? I need this release. I need to cry. Or you're upset about a breakup or something, and they're like, oh, he wasn't no good for you anyway. Don't worry about him. And they want you to move quickly past that instead of allowing you to have that experience. Yeah. Well, you get to have that experience unhindered, freely, with the therapist.
And learn from it. And learn okay, what did I do in this process that I could have done differently? Or, and you know, just to process that pain, I think is what I learned is so important in my grief counseling. Well, you have been awesome. Let me ask you a few of my last rapid fire questions.
Sure.
Okay, so what are you reading now, or what do you suggest that we read?
So I have two things. So I have one book that I'm reading and one book that's next in my queue. So the first book I'm reading is called Beyond Positive Thinking by Robert Anthony, and I'm reading that for leisure. And then the next book that I'm reading, which is more along the lines of professional, but this is a book that I would suggest for anyone, The Body Keeps Score, Brain, Mind, and Body in the Healing of Trauma. And that's by Bessel. Okay. So that's a good book, and it talks about how we experience trauma. Like, have you ever thought about different dates that come up and you find yourself feeling funny and you don't really realize what's going on, and you might be in a different mood, and you don't really realize what's going on until you look at the calendar and you're like, oh, this is the day that this happened 10 years ago. because our body keeps score and we have muscle memory. So this book unpacks that.
Ooh, that's really good. So when you, beyond positive thinking, because I think we all think that positive thinking will get us through it all.
Right.
You know, like
We do.
we can manifest this positivity just by thinking it. Ooh, I'm excited. I'm right. I wrote that down because I got to read it.
Yeah. Really
What's
good.
something that you want to unlearn?
So what I want to unlearn, and this is something I've been working on, having to be strong, because I feel like I'm the strong one everywhere, right? And having to do everything because people don't do it the way I want it to be done.
Yeah, I'm going to move on to the next question. We'll look at this. And
Did I hit a nerve with that one?
Yes.
Mm-hmm.
What is your hope for the world?
One word: healing.
Yeah. I think that will bring us to a place of peace and serenity then, if we are here.
I really believe that.
And so where do we go from here? So we have all of these instances of Black trauma. We've got a history of Black trauma and Black pain. And we have these stigmas of Black mental health. What next?
So I want us to go as far away from where we are now as possible, right? So this is our launching pad. This is our launching ground. But the result has to be better than what we're currently experiencing. The result has to be better. So if we can get away from this place and have that healing that I spoke of, that's where I want us to be.
Awesome. And so I know that you are a busy woman and people might be clamoring for you to talk more to them. So where can people reach you if they want to? Do you have some social media handles?
I do. So I am on most social media, because it's a lot more social media out there than I knew about. And I thought I was doing something being on the big three, right? So Facebook, you can look up CLS Comprehensive Services. That is my agency. On Twitter and Instagram, both, it is CLS Counseling. And then as always, you can go to our website, which is www.clsservices.org.
Thank you so much, Dr. Stewart, for your
time.
Thank you. I really appreciate you talking to us and unpacking Black trauma and Black mental health and destigmatizing it for us and letting us know that, you know, the label is the thing that we know, but not everyone has to know, and it doesn't have to define us.
It doesn't.
And I really appreciate you saying that. And also, I appreciate you being kind and identifying that us talking to Big Mama and talking to our pastors was okay.
Yeah.
Move past that. Those are the things, the real things that I'm going to take from our talk. So thank you so much for joining us, and I really appreciate your time today.
Thank you so much for having me. I had an amazing time.